It was 1998 and Esmira really wanted to have a baby of her own. However, she was barren, so she decided to adopt a 7-year-old boy from Ghana. On July 2nd, she took a flight from Georgia to Ghana to adopt Daniel. About a year later, Daniel started to experience nausea, vomiting, and diarrhea. He had a fever of 104. Esmira thought it was just the flu, but a few days later, Daniel started to cry about something burning on his foot.
Mom, my foot hurts. I can't walk. Oh my gosh, honey, your foot is so red. What's going on? We have to take you to the doctor right away.
Meanwhile, at the hospital,
Hello, Daniel. My name is Dr. Jones. What seems to be the problem today?
Hi, my foot hurts and my mom worried about it. So we came to see you.
He's my adopted son from Ghana. A few days ago, he started to experience extreme vomiting, diarrhea, and fever. Today, he cried about his foot, and when I looked, I saw this inflamed sore. What could it be, doctor?
Well, let me run some tests and I will be right back. Well, Mrs. Mira, your son's foot sore isn't just a regular sore. It's actually more severe than I suspected.
Well, what is it?
Have you ever heard of Dracunculiasis or guinea worm disease?
No, not really. What is it?
Dracunculiasis is a crippling disease caused by the Dracunculus medinensis, which is a long thread-like worm. The worm is from the Dracunculidae family. It is very common in third world countries, specifically in communities of Africa, such as Chad, South Sudan, and Ghana. You said Daniel was from Ghana. He must have gotten infected there.
Well, how did this happen?
They must have given Daniel unfiltered water to drink.
How did unfiltered water give him the sore on his foot?
Well, it all starts when an individual consumes water that isn't purified and is filled with tiny scavengers that look like little water fleas called copepods. These copepods consume L1 larvae that have been released from a Dracunculus medinensis worm. The larvae become L3 larvae within the copepod in about 2 weeks before they can infect the human.
So wait, the water in Ghana was filled with these copod creatures that have consumed the eggs from the water worm? These copods are too small for anyone to see, so they gave Daniel dirty water to drink, not knowing it was infested with these disgusting things?
I'm afraid so.
Well, what happens next?
When the copepods are ingested and move through the digestive system into the stomach, the copepods die from the stomach acids. When the copepods die, the larvae are released. Then they move into the abdominal cavity.
So the male and female worm are both inside Daniel?
No, Daniel only has one female worm now. The female and male mate to impregnate the female in order to produce more larvae for her to release later on. After they mate, the male dies.
So how did Daniel get a blister on his foot if the worm lives in the abdominal cavity?
During the 10 to 14 months of infection, the pregnant female worm begins to migrate out of the abdominal cavity, damaging deep connective tissues on its way to the limbs and feet. She may end up in the pancreas, lung, periorbital tissues, testes, pericardium, and even the spinal cord. The worm and Daniel headed towards the feet through the subcutaneous tissue and penetrated the epithelial tissue on the foot. This is why Daniel has the sore. The inflammation of the foot is causing Daniel pain and is preventing him from being able to walk. The whole process takes about a year, and symptoms rarely show until then. Daniel's symptoms resulted from the migration of the worm. You said he was experiencing nausea, vomiting, diarrhea, and then developed a fever a few days ago. These symptoms are pretty common. The fever occurred as the blister was being formed because the immune system is trying to get rid of the infection. However, the worm is a parasite and not a virus or bacteria, so we will have to remove it manually. I'll call in the nurse, and she can give you a bit more information on the parasite and how we can help Daniel.
I know subcutaneous tissue plays a huge role in the human body. It regulates temperature, pads the body, protects the bones, muscles, and prevents organs from physical damage. It connects the dermis to the muscles and bones in the body with the help from specialized connective tissue. It assists the function of the dermis by providing support to the blood vessels, lymphatic vessels, nerves, and glands that pass through the dermis layer.
Hello, Daniel. I see you have a blister on your foot. I have a few more things to go over with you. Since the parasite cannot be removed by the human body, we will have to hospitalize you here for about 10 days. This will ensure proper removal of the worm. If the worm ends up breaking, it can retract back into the blister and cause secondary bacterial infections. This can lead to further bone, skin, and muscular tissue damage and cause more pain than ever. Further infection may cause the joints to become inflamed and locked, which causes the individual to become crippled.
Alright, what will be the next step?
We will prescribe Daniel with aspirin to help alleviate the pain. The blister should burst within the next 24 to 72 hours. The first thing we need to do is submerge his foot into a bucket of water. The temperature change will encourage the worm to emerge out of the blister because it has a natural tendency to release its larvae when in contact with water. We will then wrap the tip of the worm around a stick or gauze and gently twist the stick as the worm wraps around it. We will try to remove at least 2 centimeters a day until the worm is completely removed. Throughout this process, we will add a topical cream to the foot in order to prevent further secondary infections.
Dracunculiasis, outcome, statistics, and conclusion. Outcome and statistics. If the treatment of removing the worm is done incorrectly, the worm will break and retract back into the blister. This could lead to severe limb and foot damage, hence the adjective crippling used as an association with the disease. Based on dracunculiasis outcomes in Ghana, of the 280 people followed, 46%, or 98 of the 213 known outcomes, experienced a broken worm that led to pain, edema, and a wound infection that were primarily due to aggressive attempts to remove the worm. Moreover, it was determined that 89% of the participants utilized a local water source as a mean of obtaining drinking water. This disease is treatable and can be removed 100% of the time if the process is done correctly. Dracunculiasis is caused by Dracunculus medinensis, a parasitic infection that is transmitted through infected water. Once ingested, the male and female worm mate. The male dies and the female begins her migration out of the abdominal cavity. The parasite begins to penetrate through the gastrointestinal tract and through other internal tissue until she penetrates the skin, harming the integumentary system. Here, the worm burrows and creates an inflamed blister where it will soon release its larvae. The victim will become symptomatic 10 to 14 months after infection. They will experience nausea, vomiting, fever, and diarrhea. Within 24 to 72 hours, the blister will burst. The victim may find comfort in soaking the blister in water. This encourages the female worm to exit and release thousands of larvae. When this happens, the individual may get treatment by removing the worm with a stick or gauze. If the worm is not removed properly and ends up breaking, the worm will retract back into the blister. This may cause secondary infections, joint inflammation, and stiffness, which causes the individual to become crippled or unable to use the area of infection. This parasitic infection can be prevented through filtration, such as the use of a pipe filter. If water is contaminated with someone who has had an open sore, it must be filtered before consumption. It can be purified with a bait to ensure the water larvae die. If the water is left untreated, the life cycle of the parasite repeats. There is no immunity to this disease, so it is common for an individual to continue to develop guinea worm disease several times during their lifetime. Even after treatment, they can still develop the disease. This can occur if unfiltered water is consumed again. Another good idea is to prevent individuals with blisters and wounds from going into the water. Filter your water.